I want you to walk into your bathroom and look at your toothbrush. Look at the bristles. Are they white? Or is there a faint, pinkish hue near the base? Think about the last time you brushed your teeth. When you spit into the sink, did you see a little swirl of red mixed with the white toothpaste foam? Maybe you bit into a crisp apple recently and saw a little spot of blood left behind on the fruit. For decades, we have been conditioned to treat this as a minor annoyance. We tell ourselves, "Oh, I just brushed too hard," or "My gums are just a little sensitive today." We rinse the sink, we wipe our mouths, and we move on with our lives. We treat bleeding gums as a local issue, a cosmetic problem, or perhaps just a sign that we need to visit the dentist eventually. I am here to tell you that this casual dismissal is a dangerous mistake. That pink in the sink is not just a mouth problem. It is a systemic alarm bell. It is the sign of a physical breach in the barrier between the outside world and your internal bloodstream. When your gums bleed, it means there is an open wound in your mouth. And through that wound, billions of aggressive, dangerous bacteria are pouring directly into your circulatory system. They are catching a ride on your blood cells and traveling straight down to the most vital organ in your body, your heart. Today, we are going to explore the terrifying but undeniable connection between gum disease and heart disease. We are going to explain how the bacteria from your mouth can physically attach themselves to your heart valves, causing a life-threatening infection called endocarditis. We are going to look at why something as simple as flossing might actually be more important for your survival than your morning jog. And I am going to give you a realistic, manageable protocol to seal that breach and protect your heart, even if you hate flossing or have arthritis in your hands. By the end of this video, you will never look at your toothbrush the same way again. To understand the magnitude of this threat, we have to change the way we visualize gum disease. The medical term is periodontitis. Most people think of it as just puffy gums. But I want you to imagine the surface area of your gums. If you were to strip away the gum tissue from around every single tooth in your mouth, top and bottom, front and back, and lay it out flat on a table, it would cover an area roughly the size of the palm of your hand. Now, imagine you had an open, bleeding, infected wound the size of your palm on your arm or your leg. Imagine it was festering, red, and oozing. Would you ignore it? Would you say, "Oh, it's just a little sensitive"? No. You would be in the emergency room. You would be terrified of sepsis. You would be bandaging it and disinfecting it daily. But because this wound is hidden inside your mouth, tucked away around the roots of your teeth, we ignore it. We let it bleed every day for years. And unlike a wound on your arm, which is exposed to the air, the wound in your mouth is constantly bathed in saliva and food particles, creating the perfect warm, wet breeding ground for some of the nastiest bacteria known to science. We are talking about species like Porphyromonas gingivalis and Streptococcus mutans. These are not friendly bacteria. They are pathogens. And when your gums bleed, you have essentially opened the front door and rolled out the red carpet for them to enter your bloodstream. This process is called transient bacteremia. It means bacteria in the blood. Every time you chew food, every time you brush inflamed gums, you are pumping these bacteria into your veins. Once they are in the blood, they don't just float around aimlessly. They look for a place to land. And unfortunately, one of their favorite landing spots is the rough, scarred, or damaged tissue of the heart valves. This brings us to the specific danger for the 60-plus demographic. As we age, our heart valves naturally change. They might get a little stiff. They might have microscopic scarring from a lifetime of pumping. They might have calcium deposits. This rough surface is like Velcro for bacteria. In a young, smooth heart, the bacteria might slide right through. But in an older heart, they get stuck. They latch on. Once they attach to the valve, they start to multiply. They build a fortress around themselves called a biofilm or a vegetation. This is a clump of bacteria, blood cells, and fibrin that grows on the heart valve. This condition is called infective endocarditis. It is a grave illness. It destroys the heart valves. It can cause the valve to leak or rupture. Pieces of the vegetation can break off and travel to the brain, causing a stroke, or to the lungs, causing an embolism. The mortality rate for endocarditis is high, and the treatment often involves weeks of intravenous antibiotics in the hospital or open-heart surgery to replace the valve. And to think, the seed of this entire catastrophe often comes from a pocket of infection between a molar and the gum that was ignored for 10 years. But the risk isn't just about infection, it is about inflammation. This is the second way your mouth attacks your heart. Even if the bacteria don't latch onto the valves, their presence in the blood triggers your immune system to go to war. Your liver produces a substance called C-reactive protein, CRP. CRP is a marker of inflammation. When CRP is high, it irritates the lining of your arteries. It makes cholesterol plaques unstable. It makes your blood stickier and more likely to clot. There is a saying in cardiology, you cannot have a healthy heart in a body that is fighting a war. If your mouth is inflamed, your body is in a constant state of low-grade war. Your immune system is exhausted. Studies have shown a direct correlation. People with severe gum disease are significantly more likely to suffer from atherosclerosis, hardening of the arteries, and heart attacks than those with healthy gums. It is not a coincidence. It is cause and effect. The inflammation starts in the mouth and ends in the coronary arteries. Now, I want to address the specific vulnerability of those of you with artificial parts. If you have had a knee replacement, a hip replacement, or a prosthetic heart valve, this message is doubly important for you. Artificial materials, titanium, plastic, ceramic, do not have an immune system. They cannot fight off bacteria. If oral bacteria settle on your new knee or your artificial heart valve, the body cannot clear them. The infection becomes catastrophic. This is why orthopedic surgeons and cardiologists will often refuse to operate on a patient until they have dental clearance. They know that a dirty mouth is the biggest threat to their surgical work. So, why do we let it get this far? Why is gum disease so rampant in the senior population? It is partly because of anatomy, and partly because of dexterity. As we age, our gums naturally recede. They pull back from the teeth, exposing the roots. The roots are not covered in enamel, they are covered in cementum, which is rougher. Plaque sticks to it easily. Also, many of us suffer from dry mouth, xerostomia, often as a side effect of blood pressure medications or antidepressants. Saliva is nature's mouthwash. It washes away bacteria. Without saliva, the bacteria thrive. The mouth becomes a desert, and the gums become brittle and prone to cracking. Then there is the issue of mechanics. Flossing is hard. Let's be honest. Wrapping a piece of string around your fingers, reaching into the back of your mouth, and navigating tight spaces requires fine motor skills. If you have arthritis in your fingers, if your hands shake, or if you just have poor eyesight, flossing can feel impossible. It is painful. It is frustrating. So, we skip it. We brush, we rinse with a little mouthwash, and we hope for the best. But brushing only cleans about 60% of the tooth surface. It misses the spaces between the teeth. And that interdental space is exactly where the bacteria hide. It is their bunker. If you don't clean between your teeth, you are leaving the most dangerous part of the infection untouched. I want to make a bold statement: for heart health, cleaning between your teeth is arguably more effective than aerobic exercise. I know that sounds controversial. We are told to run, to walk, to get our heart rate up. And that is vital. But you can run a marathon every day, and if you have a massive bacterial load entering your bloodstream from your gums, you are still at high risk. You cannot outrun a systemic infection. You have to close the gate. You have to seal the wound. So, what is the solution? How do we fix this without torturing ourselves with dental floss? We need to use technology. We need to upgrade our tools. The number one tool for seniors who struggle with floss is the water flosser, often known by the brand name Waterpik. If you do not have one, I want you to consider getting one today. A water flosser uses a high-pressure stream of pulsating water to blast the plaque and bacteria out from between the teeth and, crucially, from under the gum line. The water flosser is superior to string floss for seniors for several reasons. First, it is easier to hold. The handle is thick. You don't need to contort your fingers. Second, the pulsating water massages the gums. This stimulates blood flow and helps the tissue heal and tighten. Third, and most importantly, it flushes out the periodontal pockets. These are the deep gaps that form between the tooth and the gum when you have disease. String floss cannot reach the bottom of a deep pocket. Water can. It flushes out the anaerobic bacteria, the ones that hate oxygen and love to destroy bone. Using a water flosser correctly is key. Many people buy one, spray water all over the bathroom mirror, get wet, and throw it in the cupboard. Here is the trick: lean over the sink. Put the tip in your mouth. Close your lips around the tip, but leave a tiny opening for water to droop out. Turn it on. Trace the gum line. Pause between each tooth. Do not look in the mirror, look at the drain. The water will flow out of your mouth and into the sink. It is mess-free if you keep your head down. Do this for 1 minute every night before you brush. You will be horrified and amazed at the food particles that come out, even after you thought you had finished eating hours ago. That debris is what was feeding the bacteria. If you absolutely cannot use a water flosser, look into interdental brushes. These look like tiny little pipe cleaners or Christmas trees on a handle. They come in different sizes. You simply push them back and forth between your teeth. They are much easier to grip than floss. They grab the plaque effectively. For many people with larger gaps between their teeth, which happens as gums recede, these are actually more effective than string floss because they fill the space. We also need to talk about the toothbrush itself. Are you using a medium or hard bristle brush? Throw it away. Right now. As we age, our gums get thinner. Scrubbing them with hard bristles is like using a wire brush on a peach. It tears the tissue. It causes the very recession and bleeding we are trying to stop. You need a soft, or even an extra soft, toothbrush. And preferably an electric one. An electric toothbrush is not a gimmick. It vibrates at thousands of strokes per minute. It does the work for you. If you have arthritis, you don't need to scrub, you just need to guide it. Hold it at a 45-degree angle to the gum line, aiming slightly up into the gum, and let it glide. Many modern electric brushes have pressure sensors that light up red if you press too hard. This is a brilliant feature for training yourself to be gentle. We want to massage the gums, not sandblast them. Now, let's look at the chemical warfare aspect. Mouthwash. Many seniors use alcohol-based mouthwash because it burns, so they think it's working. Alcohol dries out the mouth. We just learned that dry mouth promotes bacteria. So, using alcohol mouthwash creates a vicious cycle. You need an alcohol-free mouthwash. Look for ingredients like cetylpyridinium chloride, CPC, or essential oils that kill bacteria without stripping the moisture. Or, use warm salt water. It is the oldest remedy in the world because it works. Salt water reduces inflammation and draws out infection. It is cheap, safe, and effective. I want to address the fear of the dentist. Many people over 60 have dental anxiety stemming from bad experiences in the 1960s and 70s when dentistry was much more painful and crude. You might avoid the dentist because you are afraid of the pain, or afraid of the lecture. I know I haven't flossed, I don't want him to yell at me. But you have to get over this. A professional cleaning is the only way to remove tartar or calculus. Plaque is soft, you can brush it off. But if plaque sits there for 24 hours, it absorbs minerals from your saliva and turns into tartar. Tartar is rock hard. It is like concrete on your teeth. You cannot brush it off. It provides a rough surface for more bacteria to stick to. It pushes the gums away. You need a professional hygienist to chip that concrete off. If you have heart disease, or diabetes, or artificial joints, you should not be going to the dentist twice a year. You should be going 3 or 4 times a year. Every 3 months. You need to keep the bacterial load down constantly. Think of it as a medical appointment, not a dental one. You are going to get your heart valves cleaned. That is the reality. Let's talk about the symptoms you might be ignoring. Bleeding is the big one. But what about breath? Chronic bad breath, halitosis, that doesn't go away after brushing is not just from garlic. It is the smell of the volatile sulfur compounds produced by the rotting bacteria deep in your gums. It is the smell of infection. If your spouse tells you your breath is bad, listen to them. They are detecting a health hazard. Loose teeth. Do your teeth feel like they are shifting? Does your bite feel different? This means the bacteria have eaten away the bone that holds the teeth in place. This is advanced periodontitis. If you lose teeth, you lose the ability to chew healthy foods like steak and raw vegetables. Your nutrition suffers. You switch to soft, processed foods, which raises your blood sugar, which worsens the gum disease. It is a downward spiral. Saving your teeth is saving your diet. There is another fascinating connection: Alzheimer's disease. Recent studies have found the bacteria Porphyromonas gingivalis, the main gum disease bacteria, inside the brains of Alzheimer's patients. The theory is that the inflammation from the mouth travels to the brain and contributes to the amyloid plaques associated with dementia. So, by flossing, you are not just protecting your heart, you are quite possibly protecting your mind. I want to give you a specific heart-mouth protocol to start tonight. Hydrate, drink water throughout the day to keep saliva flowing. The pre-wash, use the water flosser or interdental brushes before you brush. Clear the debris so the toothpaste can reach the surface. The brush, use a soft, electric toothbrush with fluoride toothpaste. Brush for 2 full minutes. Focus on the gum line. The rinse, spit out the toothpaste, but don't rinse with water immediately. Let the fluoride sit on the teeth. Or use an alcohol-free therapeutic mouthwash. The inspection, look in the mirror. Are your gums pink and tight? Or red and puffy? Monitor the bleeding. If you start this routine, you might find that your gums bleed more for the first few days. Do not stop. This is normal. It is like cleaning a wound. You have to clean out the infection. After about a week or 10 days of consistent cleaning, the bleeding should stop. The gums will toughen up. They will turn pink. That is the sign that the wound is healing. That is the sign that the door to your heart is closing. If you are on blood thinners, warfarin, Eliquis, your gums will bleed more easily. This scares people into not brushing. This is the wrong reaction. You must brush more gently, but more meticulously. The bacteria don't care that you are on blood thinners. In fact, the blood thinner makes the transfer of bacteria into the blood easier. You have to be extra vigilant with hygiene if you are on anticoagulants. Let's visualize the outcome. Imagine going to the doctor. Your C-reactive protein levels are down. Your heart is beating strong. Your artificial knee is free of infection. Your breath is fresh. You feel confident. This is the power of oral health. It is the unsung hero of longevity. We often compartmentalize the body. We have a doctor for the heart, a doctor for the brain, and a dentist for the teeth. We act as if the mouth is separate from the body. It is not. The mouth is the start of the body. It is the intake valve. If the intake valve is dirty, the whole engine gets dirty. Do not wait for a toothache. Gum disease is often silent until it is too late. It doesn't hurt until the teeth are loose. You have to act on the visual signs, the pink in the sink. So, tonight, when you stand at that sink, don't rush. Look at your tools. Are they helping you or hurting you? Commit to the water flosser. Commit to the soft bristles. Commit to the idea that by cleaning this small space, you are protecting the most important muscle in your body. Your heart beats 100,000 times a day for you. It never takes a break. The least you can do is make sure it isn't being attacked by bugs from your own mouth. Seal the breach. Stop the bleeding. And keep your heart safe. Thank you for listening. This is a habit that takes 2 minutes, but it buys you years. Share this with your friends who say they are too old to learn to floss. Tell them it's not about teeth, it's about survival. Stay safe, smile bright, and keep that heart clean.